And the third project is an expansion coming out of the virtual provider network, or I'm sorry, the provider virtual network and the integrated medicine education project. And that would be a clinic and school for integrated medicine. When I went to school, both for massage therapy and Chinese medicine, there were some glaring weaknesses that I noticed in different components of both. In Chinese medicine, the Western medicine side, for example, was not real strong. And the communication between the Chinese theory and the Western theory wasn't really there. So something that as a student, I and my classmates, we had to make those connections ourselves. The pedagogical rigor is not always there. We're learning from massage therapists or acupuncturists who are not trained in educational methods. And I presume that that's going to be similar for chiropractors, for naturopaths. And I would guess that even nurses and doctors have their problems with their own educational systems. So what I want to do with the clinic and school is take the strengths and put them all together, and then look at the weaknesses and see if the weakness in one system is a strength in another, and blend them together so that we take advantage of the strengths and reduce the weaknesses. Another thing, I've been in health and fitness for 13, 14 years now. I've had exposure at a lot of different levels, met a lot of different practitioners, and all along the way, every aspect of health that people are involved in tends to be isolated to itself. Someone's going to the gym, they're going to the gym. Their physician doesn't necessarily know what they're doing. Massage therapist doesn't unless they're treating them after an injury. As a massage therapist, if they've got other health conditions going on, a lot of times patients don't think about telling me, as a massage therapist especially, that they went to the doctor for an infection last week. Sometimes that might mean I work them in a different way as a massage therapist. And in my training, I haven't been trained and exposed, at least on the academic side, to how to integrate or interact with other practitioners. I've worked in a couple of settings, both St. James Infirmary and Haight-Ashbury Free Clinic, that it is more of an integrative setting. So I have an opportunity to see Western medicine in practice, or mental health services in practice, or harm reduction for drug use, or sexual addiction, or whatever. So that's a unique experience that I have through the clinical environments that I've been in, but that's not something that I was trained in. I would like to create an environment where we can train practitioners how to work with each other, so that everyone is learning under the same roof as they're going through academically. And then there are times where there's overlap between, just like physiology and anatomy is going to be the same whether you're teaching an acupuncturist, you're teaching an MD, or a naturopath. It doesn't matter. It's the same stuff. So we can get the best teachers to teach them all. And then there's the clinical integration as well, creating a clinical environment that is not, like, both Haight-Ashbury and St. James are pretty much bootstrap operations, always straining for funds. want to create a school where that's not the case. And coming from an integrated model, that'll be difficult. Getting the funding is going to be an issue. The school's not going to start immediately. But the goal is to have something that's stable and strong, and practitioners learn what it can be like to be among strong practitioners in other modalities. They can learn what the other modalities are good for, and they learn that respect. Everyone is equal in being able to care for the patient, assuming that they're treating the appropriate conditions. So where I am right now is the recruitment phase, getting people interested in the ideas, getting people to participate in the provider virtual network, getting people to contribute to the education project. And then from those two, recruit the teachers, recruit the investment to get the clinic started. So that's the dream. That's the three projects.